Hello, Mr. Jones. My name is Hannah. I will be your nurse today. Can you please verify your date of birth and name for me? And at this time, I'd be checking his wristband. Today, we are doing a wound assessment and wound dressing change. At this time, I would check physician orders and see if any pain medicine was administered. All right, Mr. Jones, I do see that your pain medication was administered 15 minutes ago. How are you feeling? On a pain scale from being 0, no pain, to 10, the worst pain you've ever felt, can you rate your pain on the pain scale for me? All right, I would provide privacy for Mr. Jones and wash and dry my hands. I'm now going to position Mr. Jones. All right, Mr. Jones, this is a sterile procedure, so it may be a little bit painful, but please do not touch your wound or any supplies that I'm using. All right, I'm gonna pull down his blankets and apply gloves. Today, my PPE I will be using are gloves, eye protection, and a mask. All right, Mr. Jones, I'm going to go ahead and pull up that gown. This time I'll bring the blankets back up to provide privacy. All right, Mr. Jones, this may be a little bit painful. Keep breathing. When I'm removing the dressing, I'll be removing it one layer at a time, pulling it toward the patient so it blocks the wound and any foul odors. All right, this is a wet to dry dressing, Mr. Jones. Keep breathing for me. All right, I would roll this into my gloves. At this time, I would assess the wound for any color, amount of drainage, odor, the width, the length, the depth. Okay, now I will wash and dry my hands, and during assessment I would have gotten my supplies needed. And during this I have a 1-inch margin. All right, I'm going to peel each supply away from my body. Cotton. I'm going to put the cotton swabs in the bowl. All right, now I'm going to pour the saline. Make sure the label is up top with my hand over the label. All right, now at this time I'll apply my surgical, I'll get the tape ready before I apply my surgical gloves so it's easier. Almost got it. All right, now I will apply my surgical gloves, and I have a 1-inch margin on these as well. First, start with my dominant hand. That's okay, I'll be able to fix it. Now I go underneath. Alright, now I'm able to remove in the center because it's sterile. Out of the way. And now I will interlock my hands. Alright, Mr. Jones, I'm going to start cleaning that wound. And now I'm going to clean from the cleanest to the dirtiest, so that means I'm going to go into the outside. So discard, grab a new swab. Discard, grab a new swab. In the outside I might have to use a little bit more pressure to get any excess. Dispose. And now I'm going to pack the wound. My gauze. Now this is a wet to dry dressing change. Now I can do an accordion or a zigzag procedure. I'm going to do an accordion style for this video. Can either pack it with my hands or the pliers that are provided. Alright, Mr. Jones, please keep breathing for me at this time. Alright, now that the wound is packed, I'm going to apply my 4x4. Alright, now I'm going to apply my ABB pad. Now, at this time, my gloves are no longer sterile since the wound is completely covered, and I'll apply the tape one by one. Alright, Mr. Jones, does that feel okay for you? I'm going to pull down the gown, remove my gloves. I was just scared of them. Now I would wash and dry my hands, cover up the patient, and at this time I would report and record. I would report and record any abnormalities to the physician right away. I would assess the color, any odor, the amount of drainage, the size, the length, width, and depth, and any supplies that were used. And now I'm going to position my Mr. Jones and lower the bed. I also will make sure the collet is within reach, but also while during my assessment, I would record his pain and ask him at the end what his pain scale was. All right, Mr. Jones, I will be back in 30 minutes, and make sure to hit the collet if you need anything else.